If you or a loved one are over the age of 65, the next time you check into a hospital, you might be handed a clipboard and asked to sign a few routine forms. Do not sign anything until you watch this video. Hospitals across the United States are quietly using legal loopholes to turn ordinary senior admissions into massive financial traps, costing you thousands of dollars out of pocket, or worse, denying you rehab care when you need it most. Today, we are breaking down the 5 dangerous hospital traps seniors fall into every single day, and the exact words you need to say to protect your health and your retirement savings. My name is Dr. Daniel Mercer. I'm a physician specializing in cardiovascular health and aging, and the pattern I keep seeing in my work with adults over 60 is troubling, not because hospitals are full of bad doctors, but because the system around those doctors is quietly set up in ways that cost seniors money and sometimes cost them their recovery. These 5 traps I'm about to walk you through are real. They happen every single day across this country. And the people they happen to are not careless people, and they are people who simply did not know the right questions to ask. By the end of this video, you will know exactly what to say. Trap number 5. And I want to start here because this one surprises people the most. A senior carefully picks a hospital, does their homework, calls their Medicare Advantage plan, confirms the hospital is in network, feels good about it. Then 3 weeks later, an envelope arrives in the mail with a bill for $1,400 from a doctor they have never heard of. The hospital was in network, but the anesthesiologist who walked into the room during their procedure, or the radiologist who read their scan, or the ER physician who saw them on intake, that specific doctor was not. They were contracted separately, and because they were out of network, the bill is the patient's problem. This is called the out-of-network specialist surprise, and it has been happening to seniors on Medicare Advantage and commercial insurance plans for years. The hospital is covered, the building is covered. But the doctors who work inside that building may each have their own separate network agreements, and nobody tells you that at intake. Now here's what changed. There is a federal law called the No Surprises Act. It was passed specifically to protect patients from this exact situation, and it gives you a right that almost nobody uses because almost nobody knows to ask for it. The moment you arrive at any hospital, before any procedure, before any specialist sees you, you have the right to say these words to the staff or the billing department. I only consent to treatment by in-network providers under the No Surprises Act. Write those words down. Put them in your phone right now. That one sentence puts the hospital on legal notice. If they bring in an out-of-network specialist after you've said that, the financial responsibility shifts back to them, not you. I want to ask you something here, and I genuinely want to hear your answer in the comments. And because someone else watching this right now is in this exact situation and hasn't found the words for it yet. Have you or someone in your family ever received a medical bill weeks after a hospital visit that made absolutely no sense? A charge from a doctor you don't even remember seeing? Tell me what happened and when it started. Your answer may help someone else watching this figure out what hit them. Now, trap number 4, and this one does not involve paperwork at all. It involves a phone call and a rushed conversation when you are at your most vulnerable. Hospitals are businesses. They have financial pressures from insurance companies to move patients out of beds as quickly as possible. What that sometimes looks like on the ground is a discharge that happens before a senior is actually ready. A doctor comes in and says the words, "You're doing well enough to go home." And because it's a doctor saying it, most people nod, get dressed, and go. 3 days later, they fall getting out of the shower, or their wound isn't healing, or they end up back in the emergency room, which costs 5 times more than if they had simply stayed those extra days. This is sometimes called rehab dumping. And the cruelty of it is that Medicare patients have a legal right to appeal a discharge they believe is premature. That right exists right now. Most seniors have never been told about it. Here's how it works. If a hospital tells you it's time to go home and you do not feel ready, or your family does not feel you are ready, you can request an expedited appeal through your local quality improvement organization, also called a QIO. You can find yours at Medicare.gov. Once you file that appeal, the hospital cannot legally discharge you while the review is being processed. You are protected. The key is knowing to ask. The words you say to your care team are simple. I don't feel medically ready for discharge, and I am requesting an expedited appeal through the QIO. Margaret, 71, a retired school librarian from Columbus, Ohio. She had a hip replacement, and on day 2, the physical therapist came in, did a short evaluation, and by that afternoon, her doctor was suggesting she go home the next morning. Her daughter, who had watched this type of video, asked the nurse, "Can we speak with the case manager about requesting a QIO appeal?" The tone in the room changed immediately. The discharge was delayed. Margaret spent 2 more days in the hospital completing her physical therapy baseline. When she got home, she said, "I would have fallen the first night. I know I would have." Now let's go to trap number 3, and this one starts before you ever leave home. When a senior is admitted to a hospital, the facility has its own internal pharmacy, and that pharmacy runs on something called a formulary, a specific approved list of medications they stock and dispense. The maintenance medications that have been carefully calibrated for a senior over months or years, blood pressure medication, heart medication, thyroid medication, may not be on that formulary. So the hospital substitutes a different brand, a different generic, a different version, and they do it without always telling the patient, sometimes without telling the admitting doctor clearly enough. For adults over 60, a sudden medication switch is not a minor inconvenience. The cardiovascular system in